good? Hi, everybody. Thanks for joining us. David Eby, Premier of British Columbia. We have had an absolutely wonderful welcome here in Halifax. I want to express my appreciation to our hosts here, Nova Scotia, for welcoming everybody in such a great way. Every Nova Scotian we've encountered has been incredibly welcoming. As a tourist in this town, appreciating what's special about Nova Scotia, it reminds me about what's special of our home province in British Columbia. We're proud of a lot of things too out west, and one of the things we're particularly proud of is our wine industry. It's a driver of tourism for us. It's an award-winning sector. It's a significant portion of domestic manufacturing, and it's a source of pride for all of us in British Columbia. And not just in British Columbia. We know we have fans right across Canada and around the world of BC wines. And we have really worked hard on that as a province across a number of generations in British Columbia. We have gone through a challenging time in our relationship with Alberta. Lots that we've been successful in working on together. One of the areas where we've been challenged is the ability for BC wines to cross the border into Alberta so that Alberta consumers can enjoy BC wine too. I had the opportunity to raise this concern with Premier Smith, and she committed to me that she would take it back and work with her team on this. We had some great advocacy from some MLAs from wine country in British Columbia, Rolly Russell and Harwinder Sandhu as well. And I want to thank Premier Smith and her team because they worked with our team and came up with a solution where Alberta consumers will again be able to enjoy BC wines starting today. Albertans who are visiting BC wineries can sign up for wine clubs. Direct-to-consumer shipments to Alberta can start again. And this is great news for our wine sector because it has been challenged as well, not just by this, what I'll describe as a hiccup with Alberta, but also the impacts of pretty wild swings in weather, extreme hot and extreme cold temperatures that have damaged a number of vines in the Okanagan region. And so this is good news for them at a time when they really need it. And so again, I'd like to express my appreciation to Alberta for working with us to come up with a solution that works for everybody so we can move forward on all the other issues that we need to work with Alberta on, and I'm looking forward to that. So with that, I'd like to pass the microphone over to Premier Smith.
Well, thank you for joining us today. I'll just also echo Premier Eby's statements about the incredible hospitality that we've had here in Nova Scotia and the great discussions that we have had around the coffee table, which you'll hear a little bit more about when we do our formal press conference later. But I am pleased to be here with British Columbia Premier David Eby to highlight the strong ties that our two provinces share. Alberta's government has long been an advocate for reducing red tape and removing barriers to interprovincial trade, and together with BC, we are doing both. I'm happy to say that we have reached an agreement to allow wineries in each province to sell directly to consumers in the other one. Albertans will once again be able to order wine from British Columbia producers and have it shipped to their homes, and buyers in BC can do the same with new and growing Alberta wineries. So this means more consumer choice, more market access for businesses, more growth and prosperity for Albertans and British Columbians. And the agreement also means that we can ensure consistent charges are applied to all wine sold in Alberta. And in 1 year, we'll take a look at how things are working and we'll revisit our agreement. And I'm grateful to Premier Eby and his government for their can-do approach to problem solving. He mentioned a number of advocates on behalf of BC Wines. Let me add that Alberta consumers are an advocate as well. We heard a lot from them about how they wanted this direct delivery restored, and so I'm glad that we were able to come to an agreement, and I'm confident that it is a sign of things to come. All parts of Confederation have an interest in improving trade between the provinces, and where there's a will, there is a way, as Alberta and BC have just proven. Thank you. I'm happy to take questions.
Just before questions, I have a small presentation to make to Premier Smith. It's a beautiful bottle of BC Rosé from a small winery in the Okanagan, a family-owned winery. So,
I'll take that. Who gets the markup on this one?
You have to share it with the whole team. Yeah. We paid the markup on this. This one's on us. Yeah.
Beautiful. Any questions?
For reporters on the line, please press star 1 to enter the queue and unmute when called on so we can hear you properly here in the room. One question, one follow-up, and we'll start with reporters here in the room. Please use the microphone provided and introduce yourself.
Hi, Kat Tunney from CBC. Kind of to zoom out a bit, you have asked Prime Minister Justin Trudeau to basically stay in his lane when it comes to jurisdiction. Why should Canadians care about jurisdiction when it comes to services that they can benefit from?
Well, look, I mean, I can tell you we have had 112 court cases over the years where the courts have told provincial governments they have to stay out of federal jurisdiction. And we haven't had to have a case, I think, since the 1950s as a result. And so we are wanting to draw some clear jurisdictional boundaries, because part of the reason, especially when it comes to social programs, that we have the approach that we do, where they're designed at the provincial level and funded at the federal level, is so you don't have duplication of administration. One of the things that we do know is that one of the biggest costs of delivering a social program is developing the infrastructure, the bureaucracy, and the payment system to do that. And so when the federal government announces programs that are duplication, whether it's dental, whether it's long-term care, whether it's pharmacare, whether it's school lunch programs, then you're paying for twice as many civil servants to deliver the program, which means you're not getting the dollars down to the people who need them. So what we have advocated is work with us. If you want to get involved in assisting us in cost sharing, then use our architecture and provide funding so that we can expand the program. That's the approach that we're going to be taking on all of these programs that they announce. Did you have a comment you wanted to make?
That's good.
My follow-up, since I have you both, I want to ask about the RCMP, since both of your provinces have contract policing. I'm sure you saw the letter that Minister LeBlanc wrote, kind of outlining Ottawa's vision for the RCMP going forward. Just wondering if you have any concerns, are you comforted at all by Ottawa's kind of vision going forward with contract policing?
Look, we've taken an approach in our province that we have we want to support our municipalities in whatever type of policing makes sense for them. So in some communities, it's peace officers. Some have municipal police forces. Others are working in a regional way. Others are being policed by sheriffs, and still others have RCMP. And we're going to continue to support our municipalities to make sure that they have the approach that's right for them. Unfortunately, we pay for 1,911 RCMP officers, and we have over 400 vacancies. And so we just simply can't allow for those holes to go unfilled. And it's part of the reason why we've been bringing in new sheriff's detachments and new sheriff duties, and also supporting our municipalities and expanding municipal forces, just so that we make sure that public safety is number one.
Our issue is identical to Alberta's, unsurprisingly. You know, we have the same policing model. We have a major municipality that is going through a transition from the RCMP to a municipal force. And part of the public safety reason for compelling the municipality to complete that transition was the fact that we're short RCMP officers in British Columbia. And their desire to go back to the RCMP and the collapse of their municipal force would have resulted in a serious public safety issue. That's how tight things are for RCMP officers in British Columbia. We increased funding for police across the province. We've got the money to pay for the officers. We just don't have the officers. So I'm happy to have the federal government confirm that they're continuing with contract policing, that they're going to take on that responsibility, they're going to do that work. We need that to manifest in RCMP officers trained, deployed to British Columbia, filling those vacancies, ensuring public safety for British Columbians. It's a very basic part of that role.
Premiers, can you answer the question in regards to the privatization of healthcare, whether or not your two provinces and in your discussions with other premiers see that increased privatization is perhaps the solution to dealing with the issues that we are facing right now, whether it comes to ER times, family doctors, specialties, like, has that been discussed? There was a big rally earlier today against more privatization, and where do the two of you stand? Do you believe that more privatization, and in what areas, is the solution?
Well, look, I think we have to make sure we're talking about the same thing. We are committed to making sure no one pays out of pocket for hospital services or to visit a family doctor. Those are two principles that are enshrined in the Canada Health Act. So that's the starting point. Who delivers that publicly funded service, I suppose, is a different question. And what we are trying to do in Alberta is allow for more participants to be able to get publicly funded services. It's part of the reason why we're adding nurse practitioners to be able to set up their own private practices so they can bill the province directly so that they can treat more patients. It's part of the reason why we're negotiating with the pharmacists so that they can expand their scope of practice with primary care and do more dispensing so that they're also able to publicly bill our system. We also have charter surgical centers where publicly funded cataract surgeries, publicly funded joint surgeries can be done so that we can specialize and provide more options so that we can clear up waiting lists. But we're committed to the principles of the Canada Health Act. We just think that there can be more providers so that they can specialize and provide better service.
Thanks, Danielle. In British Columbia, we've added just over 300,000 people in the last 2 years to our province. That's well in excess of 10,000 people a month. These folks all need medical support. The big challenge that we're facing in British Columbia is a shortage of healthcare professionals. And one of the anxieties I have about increasing privatization in British Columbia is that having companies that will pay higher salaries for these medical professionals will be in direct competition with the province of BC for our public facilities. We have turned to the private sector on occasion to assist with backlogs. For example, with increased demand of an aging and growing population for cancer care, we've turned to a clinic in Bellingham. These are American doctors. It doesn't take resources away from British Columbians in British Columbia to have people visit that clinic and get that cancer care. So where it's possible to actually expand services available, it's something we're absolutely willing to look at. The challenge, though, that we face is with a shortage of healthcare professionals, if we're suddenly competing with the private sector, it's going to be paying higher salaries, then we have to pay higher salaries too, and then costs go up without the level of care going up in the province. And so we're keeping a watchful eye on that and really focusing on recruitment, retention, and recognizing the credentials of internationally trained healthcare workers to deal with our healthcare crisis rather than looking to privatization as the solution.
To both premiers, please, but perhaps Premier Smith first. Your government has said that it will opt out of dental care. It's considering opting out of the pharmacare program. I'd like to know, in terms of opting out, which is a possible option, how would the federal government and how would the Canadian public know that if you opt out and you still want the funds to put in those programs in your own jurisdiction, how do we know that there will be a level of accountability from your government to ensure that those services are getting to Albertans?
Well, look, I mean, the language that we're using of opt-out is to send a signal to the federal government that we would like them to fund our program. And if they're not happy with our approach, then I guess they'll continue operating a parallel program. But I don't think that that's good for patients because I think it's created confusion. In Alberta, for instance, on the two programs you mentioned, we've had a publicly funded dental program since 1973. We have 500,000 people on it. And when we did our assessment of the federal program, if we collapsed our program and just went to theirs, 100,000 people would have been uncovered because we cover those who are vulnerable on AISH and those who are children of those who are vulnerable as well. We are not going to create a program. We're not going to opt out of our own program or cancel our own program if it leaves people uncovered. So that's why we're frustrated that they didn't come to us first and work with us to expand to different categories of patients. That's what we're trying to do, is they're saying, let's take this 2-year period and let's see if we can get that right. On pharmacare, it's the same thing. Like, I can't go to the people who are covered under our pharmacare plan, which offers 5,000 drugs, and say, okay, we're collapsing our program, and now you can have a 2-drug plan by the federal government. That's not appropriate either. What we want them to do is to come to us so that we can maintain our 5,000 drug program and just expand it to more people. So that's where we're hoping the negotiations will go with the federal government. We want people to be covered. We want, especially the most vulnerable and those who are at the low end of the income scale. And it would have been far better rather than them create an architecture and a whole separate system with all that administration, if they just collaborated with us first. We recognize that every province is at a different state of development of those programs, and that's fine. But you can't just put a one-size-fits-all program across the entire country, especially when we're so far advanced on these two programs ourselves. I don't know if you have anything. Okay.
Hi there, Premiers. It's Lindsay Armstrong with Canadian Press. I'm wanting to know, with regards to this wine agreement, why the about face? What's changed here?
There's a couple of things. One thing is that we wanted to make sure, I mean, everybody knows that in each province, there's a markup that's charged, that each province generates tax revenue from it. This was just a way in which the markup was not being collected. And we think you need to have fair treatment. If you're going to be selling into our market, you have to be treated the same way as every other person who is buying it through a liquor store. So that was one agreement that we wanted to address. And so we're going to create a virtual warehouse to make sure that those fees are collected and rebated. And we're going to work to see if we can also find ways to expand the offerings in both provinces. And I think that that's an important step to try to make sure that the producers of wine in both provinces have an opportunity to sell in both markets.
Can you talk a little bit more about how exactly regulating this will work? How will consumer sales be collected? Will there be a legislative change? How will you verify age?
This will be the thing that we work out over the next couple of months, is that we're calling it a virtual warehouse because right now in our market, we have a warehouser who collects all of the product, applies the markup, and then sells it out to the retail stores. And so we don't want to interfere. It kind of defeats the purpose of direct to home to have it being centralized at an actual warehouse. So we're trying to create a virtual warehouse. It'll be a best efforts, I think. I trust that once we put the rules in place, that wineries are going to assess the amount that they owe, and they're going to collect it, and they're going to remit it. I think that we have to trust that these businesses are sophisticated, and they will do that. And so we're just trying to close that loophole, but we'll figure out exactly how it works over the next couple of months. Did you have any more to say?
Thanks, yeah. The producers in British Columbia, the wineries, are really clear. They want to ensure that they're on side with Alberta's rules and any markup in Alberta. And they will be fully cooperating with the system that's set up in Alberta. British Columbia will provide support on our side to make sure that they're adhering to that. But I don't think that we'll have any issues around that. They want to keep an open border with Alberta for their products because some of their best customers are in Alberta.
Heidi Petracek with Global National. Thank you for being available, Premiers. Premier Smith, I do want to circle back on the healthcare discussion a bit, only because there are people outside who are concerned when they hear provinces bringing up issues over jurisdiction with healthcare decision-making. They worry that means, you know, Ottawa and provinces can't work together and nothing's going to get solved, basically. So how can you reassure people who hear that kind of talk that there is a partnership moving forward to solve some of these issues in healthcare?
You know,
for
we
people?
come to the table as a willing partner. And I think the proof in that is that we signed a 10-year agreement with the federal government that committed them to spend $22 billion additional dollars. Plus, we came to an agreement on 4 side deals where we identified 4 priority areas that we wanted to support and deliver together. The thing that's confusing for us is they know how to do this because they've done that before. Why are they doing something different when it comes to long-term care, dental care, and pharmacare? We just would like them to use the process that is tried and true, that has always worked, where we come to the table, we negotiate, we develop the side agreements, and then we develop some metrics to demonstrate that we're going to achieve them together. I think if they did that on more issues, they would end up finding that they're able to achieve their targets and have the dollars go further. So that's what we're hoping that they will do with these other programs, is to make sure that they're working with us so that we have a single administrator. And that's one of the principles of the Canada Health Act, is to have a single administrator. They're actually creating duplication. And so we think that they would be better off working with us under the traditional way.
What's the odds of that happening?
Well, you know, Quebec has had a lot of success in doing these kinds of things where they say, you know what, we're opting out, but we'll take the money. And we think if it's good, if it works for Quebec, it should be able to work for us as well. I mean, everyone has an interest in making sure that patients are covered. That's, I think if everybody comes to the table with that kind of goodwill, we'll be able to achieve what we hope to.
Good afternoon, Patrice Bergeron, La Presse Canadienne, the Canadian Press. Premier Legault tries to convince colleagues to accept more asylum seekers in their provinces. Did he talk to you, and did you accept to have more asylum seekers?
Look, one thing I would say, I'll speak for myself, and then Premier B can speak for him. We're experiencing a similar type of pressure that the federal government has to align the number of people coming into the country with the capacity of our system to be able to support it, whether it's building homes or whether it's providing healthcare or education. And I think in Quebec, it's acute. The way Premier Legault described it is they're 22% of the population and receiving over 50% of asylum seekers. And so I have some sympathy. We're 12% of the population, and we're now receiving 22% of newcomers to Canada, and we're seeing the same kind of pressures. With housing prices escalating, with the pressure on students in our school system and the pressure on our healthcare system. So I think what we are asking for is for the federal government to work with us to align so that we can bring in a number of newcomers that we can support in every province, and then also make sure that it's not disproportionately falling on one province or another. So I think that, I heard Premier Legault's message loud and clear, and I hope the federal government does too, because we're a welcoming place. We're a nation of newcomers and immigrants, and I think we want to make sure that everyone who comes here feels supported, and it may be that it's in a bit of an imbalance at the moment.
Premier.
Thanks. In BC, we have in our last year's data, about 15,000 people a month coming to the province. This is an historic high. Since we started collecting data, to have 180,000 people come in a single year is an astonishing number. They're in varying states of vulnerability. Some are really highly credentialed workers that are coming to work jobs in the six and sometimes in excess of that figures. And there are people who show up with absolutely nothing. We have significant, nationally, not compared to Quebec's, but significant and growing number of asylum seekers in British Columbia. Every province seems to be grappling with the remarkable immigration numbers that we're seeing. And particularly around the ability to provide services and support people with integration, including housing, healthcare, all the needs that they have. Those needs are particularly acute for people claiming refugee status, coming from war zones, coming with no documentation, coming not speaking the language, coming traumatized, struggling with different issues. I completely support the idea that Quebec receives federal support to support these people. Who are arriving in such a state of vulnerability. What I do not support is that program is not available nationally, that it is only available for one province. It needs to be, if it is a federal program to support new arrivals, it needs to be in place nationally. Premier Legault did raise his wish that provinces and territories take on more asylum seekers. It was a topic of conversation around the table. Including the need that we all face around additional housing and federal support for those asylum seekers. It was a constructive conversation. I'm sure it will continue.
Thank you.
We'll take one more in the room and then go to the phones.
Hi, Sébastien Desrosiers from Radio-Canada. Premier Smith, I was wondering if the topic of equalization has come up. I know Premier Irby talked about it yesterday, saying BC could support Newfoundland Labrador's court case. What about Alberta?
I've talked to Premier Fury about that, and of course we have issued an equalization paper. We've had a referendum in Alberta saying that we need to take equalization out of the Constitution. We want to renegotiate the formula. We've been very clear about that. We are assessing whether to intervene in the case. What we don't want to create a situation where Alberta is the only net payer into the equalization system, because if the rules are changed so that Newfoundland and Labrador receive payments, then presumably everyone but Alberta will also receive payments, and we don't think that that's a very fair situation either. One of the things we would like to see is something more along the lines of what Scott Moe proposed a year ago, where half would be equalization and half should be converted into per capita funding, because every one of us has pressures. We've talked about immigration pressures, but we also have pressures associated with the high growth in education and healthcare as well. So I think that there needs to be a revamp of the equalization formula. I don't believe it was ever designed so that a small province like Newfoundland and Labrador would be a net payer, and Quebec and Ontario would be net recipients, which is what happened this year. So I think that, that's part of the reason for the case, and we'll assess whether or not we should intervene on it as well.
And do you think it's possible to find a consensus here around the table since, as you said, some provinces like Quebec and Ontario are getting a fair amount of money?
It's, I don't want to speak for any of the net recipients of equalization. They may have a bit of a different view than those of us who are net payers. And that's part of the reason perhaps why a court case is maybe the most beneficial way to address it, is that we can each put our cases forward about whether or not it's living up to the original intention of the program, get some guidance from the court, and that may then spur a discussion with the Prime Minister about how that can be changed for future.
Thank you.
Sarah, go ahead, one.
Hi there. I'm wondering, Premier Eby, I'd particularly like to hear from you. I just want to go back to this question of the stay in your lane message. Can you just explain why that's necessary right now?
I think that one of the biggest challenges we have in British Columbia is that there are some core areas of federal responsibility that make a difference in the lives of British Columbians. Like whether or not we've got sufficient road and transit infrastructure, sewer and water treatment infrastructure to be able to support a growing population. The federal government has always and traditionally had an infrastructure funding program to help pay for that stuff until this most recent budget. And now it's conspicuously absent. When we talk about our healthcare system, the federal government has always had a role to play in coordinating a national healthcare system. When you talk about training healthcare professionals, how they move around the country, really key issues, you can't get a meeting with the Prime Minister to talk about healthcare. And so for us, it's not so much, welcome the funding for birth control. We already have a free birth control program in British Columbia. We'll work with the feds, we'll figure it out. That funding is always welcome. But in those sort of core federal responsibilities, like we're talking about immigration, what is immigration in Canada look like? Are the rules being enforced on the ground when it comes to the buying and selling of access to Canada involving private businesses and shady immigration brokers? Are there port police in British Columbia? These core federal responsibilities, they go unaddressed. And so, again, the school lunch program, great. But what about these core areas of federal responsibility? And that's the frustration for me, is we talk with British Columbians every day about what these challenges look like for them when the federal government's not doing that core work that they should be doing. And for me, that's what that message is about, is like, if your lane's in great shape, come on over and help us with ours. But that's just not the case in British Columbia.
So you just had a major deal with the federal government, I believe, and you can correct me here whether or not that predates you personally, on healthcare funding. There are all these side deals being worked out. So I'm a bit surprised to hear you say, like, we can't even have a conversation with them. It seems like it's not that long you were in Ottawa talking to federal officials.
Yeah, you have a different recollection of that meeting than I do. The deal was presented to us, and the Prime Minister left the room. So what I'm talking about is an ongoing, collaborative, national level partnership to support a national healthcare program. Interprovincially, we're trying to do that work among ourselves. We're trying to work individually with provinces about streamlining our colleges' requirements for different healthcare professionals and whatever. Wouldn't it be great if there was a national government to coordinate that discussion? Oh, there is one, but it's not happening. And so that is the work that's not about money, it's not about additional funding, it's just about, can we coordinate nationally on these areas of shared interest? And that is where it sometimes feels like we're just beating our head against the wall. I don't know how many gatherings of Council Federation now where we've punctuated our report out by asking for a meeting with the Prime Minister and the First Ministers from across Canada. And that call continues to go unanswered, and I cannot understand why, because we have a lot of work to do together.
We're going to take a couple from the phones. Matthew Black, Post Media.
Oh, hello. I was just hoping someone could speak to again how this came together, what changed, and why we need these new rules.
Well, look, I mean, there are a lot of Albertans who love BC wine, so we were hearing that they wanted to have a solution. And we also heard directly from the vineyards, who I think are really struggling with especially some of the weather issues that they face. And we don't want to harm either our customers, and we don't want to harm the vineyards as well. So we felt it was important for us to get to an agreement so that the shipments can flow again. The issue really was just making sure that all the product coming into Alberta is treated fairly and equally. So that is going to be one of the issues that are addressed, and to make a best effort to try to get products flowing the other way as well, so that we have more options for consumers in both markets. Do you want to comment?
And I can't swear it's related to me putting on that Oilers jersey, but I can assure you that it probably didn't hurt.
Follow-up, Matthew?
Yeah, I'm just curious when we might get more details. It sounds like we can buy the wine directly, but still some vagueness over how that will work and when it will happen. When can we expect those details?
We're working out the virtual warehouse, because that's going to be a bit of a technological solution. We'll likely have a paper-based solution in the meantime. What we would anticipate is being clear about what the markup rate is. I think the vineyards know, because they go through for products that sell in our liquor store. They know what the markup is. And so we'll keep track of how much gets sold direct to home, and then we'll be able to do this in a virtual way once we've got the technology solution in a couple months' time. That's my anticipation of how it's going to work. We'll do some proactive communication with the wineries. I believe there's over 300 in British Columbia. There's 16 in Alberta. It's a little bit easier, I think, for us to communicate it out to the wineries in Alberta, and I'll leave it to the Premier B to answer as well.
For us, the most important message is that those consumers are able to order now. I'm very grateful to Alberta that they were able to say, look, there's going to be this period of implementation. We don't want to hold things up. You can go ahead and order your wine now. That was an important decision. I'm grateful for it, because it is going to take a few months for us to harmonize our systems between the two provinces to get it right. But we're committed on our side to support that. The wineries are committed to support it, and we'll get it done, and it'll be effective and minimize that the bureaucratic red tape, so it's as seamless as possible for the business owners and the consumers.
Our last question today is from Richard Zussman, Global News.
Thank you for taking my question. Premier Smith, what products are you talking about going the other way here to BC? And Premier Eby, BC's now been held hostage twice when it comes to our wine sector. What can you say to the sector to assure them that this isn't going to happen again as a sector becoming this political football? And what other larger supports do you have planned? Because as you know, this is largely small potatoes when it comes to the challenges the sector's facing.
I'll say in Alberta, one of the things that makes our market unique is, first of all, we've got 1,600 stores, and we've got 36,000 liquor products. So we've got one of the most open liquor markets in Canada. There are no barriers to listing a product in Alberta, as licensed liquor agents can pick and choose any products that they wish to bring into the province. As of June 2024, there are 327 licensed grape wine wineries in British Columbia. I don't know if all 327 sell into the Alberta market or sell direct to home, but there's a certain percentage of them that do. When it comes to what we're seeking for equivalency, there are 16 wineries in Alberta that produce 26 products. Now, we don't have quite the same robust offerings at wineries that British Columbia does. Just there's sort of a difference in temperature. We also have mead products, and we tend to in our market focus more on distilled products and as well as beer, craft beer. But we do have a growing winery industry, and that's where we're looking to be able to hopefully have some kind of parity.
Thanks for the question, Richard. Yeah, when you talk about the challenge facing our wineries right now in British Columbia, this is a relatively small challenge, but everything adds up for them. So I'm grateful for Alberta addressing this as quickly as they did. We are working closely with the wine sector to support them in being able to really persevere through this challenging period where the vines are dead in significant portion in many different wineries, so that they can live through that replant and regrowth period to get back on track. They've presented us with some innovative solutions that we've been working on together, and I look forward to having more to say about that soon. I know these answers can't come fast enough for those businesses in British Columbia. As far as the broader issue of BC wines between Alberta and British Columbia, we're going to have ups and downs in our relationships, and the spirit of collaboration, though, is going to endure. We have so many people-to-people ties between Alberta and British Columbia. Premier Smith's politics, my politics, they're different, but it doesn't matter, because as long as we are staying focused on what matters for the people in our provinces, we can find common ground, and we did today, and we'll continue to do that work together.
Follow-up, Richard?
Premier Eby, reports come out in BC today from the children's rep showing that the office received more than 6,400 reports of deaths and injuries impacting young people in care or receiving reviewable government services. Is this acceptable to you? And what is the province going to do to ensure that those in your care, young people in your care, are not hurt or, in the worst case, die in those situations?
Thanks. When it comes to these vulnerable kids that are in government care or in and out of government care, I think for most British Columbians, it's hard to think of something that is more heartrending when things go wrong and a child is either injured or dies. I've asked Grace Lohr to work closely with the representative for children and youth to ensure that we're implementing all of the recommendations. She's going to be speaking to that, exactly how we're going to be implementing these recommendations. And she understands, and she'll be speaking to this as well, the mission she's been given by me as minister responsible.
And that concludes today's event. Thanks, everyone.